Hi Dennis, it's Danny. I was saddened to hear of your retirement and then the underlying reasons for that. I know the nurses in the hospital have been thinking about you and speak very fondly of the time they've worked with you. On my end, and part of my training, like many of the other videos, certainly I took away the importance of patience and a calm head when it comes to approaching surgery. I often think of a time where you and I started a lysis of adhesions in a young gentleman with Crohn's disease and multiple previous laparotomies. We started that on surgery E in room 6 around 6 o'clock, and about 11 o'clock after multiple enterotomies and still many adhesions ahead of us, you said, "Oh, the tedium, oh, the tedium." And I often think of that as I approach a difficult dissection, either going through a lot of adhesions, that it's very important that you move slowly and cut carefully, and that rushing certainly doesn't necessarily always expedite the case. It's often a story I tell the residents as replacing a laparoscopic feeding J tube and creating the Witzel tunnel. That is often requires a lot of patience, and I often refer to the tedium of it. The second thing I took away from you in terms of management of the patients is when we used to run the list on surgery E, you'd often sit down and you always listened, didn't ask too many questions, which was always quite nice as a trainee. And you'd usually summarize the story with the patient's vector of health, and it was usually summarized as either positive, unchanged, or negative. And oftentimes I've found myself thinking about the patient's vector of health, and certainly if it's positive, that often will steer you away from interventions you may have planned. And a patient who has a negative vector of health, you may want to jump on. I've often used that thought process, especially when things are busy or there's complicated decisions to be made. I wish I was telling this story at our traditional MIS end of year dinner, which I always enjoy, and I'm sure it would be very lively this year. So I wish we were doing this over a beer, and you often order a steak and have extensive knowledge about the cattle that produce that steak, much more than myself, and these are things I've always enjoyed about being with you both in the OR and out. I hope you all the best as you move into the future. And like I said, many people in the hospital are thinking of you and in a very fond way.